Well, good morning. There's been some pretty tough acts to follow, but I'm so delighted to be here in Kansas, and I'm really excited to do this panel, not just because I've really gotten to know the panelists over the last few days, and they've got some great things to say, but often when we talk about disability employment in particular, and we talk about competitive integrated employment, we forget the side of the employer and the employer experience and the benefits to the private sector and how we can really pull on them as a way of just improving our overall economy here in Kansas and across the country. So in my previous role, when I was commissioner on disabilities, I got to pull from my private experience, my private sector experience in asset management. I worked in that space up in Philadelphia for a number of years. And then as I was departing that role, decided to go back to the private sector because it's such an engine for our economy. And there's a couple things that we know about the private sector. One is that when companies have diversity agendas and they have initiatives to make their workforce more diverse, and when that diversity includes people with disabilities in a very meaningful way, they are twice as innovative as their competitors right in their same sectors. But we also know that employers aren't really doing this, right? The numbers speak for themselves. About 22% of Americans with disabilities who want to be working are working today, compared to 66% without disabilities, right? When we think about all those who are in the labor force working and looking for jobs. So we've got work to do. For sure. I love that I get to talk about this kind of from both sides, having been in the public and private sector, and been a hiring manager and been a manager for people with disabilities. So we've got a lot of great things to talk about. I am going to introduce the panel myself this morning because I want them diving in on a couple of great questions this morning. So they're not sitting in the order that I planned for them to be sitting in. So we're going to do our best so I don't drop all my cards. But Stephanie Rasmussen is here today. She's 35 years of experience. She's currently the Vice President of Long-Term Services and Supports, sometimes shortened to LTSS, for Sunflower Health, which is one of Kansas's managed care organizations, or MCOs. You may often hear them referred to. And what we're going to dive into in just a moment with Stephanie is her experience at the start of her career helping people with disabilities who were in institutions come into our community and see employment as a critical component to community living. Some of you have been a huge part of that movement, so we're going to talk a little bit about that today. Solomon Parker is here all the way to my right, to your far left. He is a leader at CareSource, which is a nonprofit health plan. He has spent over 2 decades in Kentucky's Medicaid waiver program, and he is transforming the workforce experience for people with and without disabilities each and every day. We had a great conversation last night about that. Cassidi is here, and I had to rewrite Cassidy's bio for her because Cassidy's doing incredible things, and we're going to pull it out of her today with your help. She's the executive director of the Summit Future Foundation, which is working with employers right here in Kansas City, to really improve competitive integrated employment outcomes for people with disabilities, and working with employers, working with self-advocates, working with parent advocates, and some really cool lessons learned, and also bringing private sector lessons into the public sector, which is a pastime of mine as well. So we're going to talk to Cassidi about that. And then finally, Amanda, immediately to my right, she and we heard a little bit about her when we were talking about Lola's experiences and early job opportunities. But Amanda is an employment coordinator at the Down Syndrome Innovations in Kansas City, which I'm looking forward to visiting while I'm here in Kansas. And she is driving an employment program with partnerships, and I loved the list of partners. they included, but I don't think this is the complete list, the Kansas DD Council, the Kansas City Chiefs and Royals, the University of Kansas Health System, and one of my favorite places to visit, Chick-fil-A. All right, so I had to add Chick-fil-A to the list. All right. So this is our panel, and we're going to dive in, and I'm going to start with Stephanie, as I alluded to a little bit earlier. And Stephanie, the first question's for you, and I'm going to bounce around so that we keep the panel on their toes all 45 minutes. But Stephanie, let's start with you. In your career, you have been a part of transforming opportunities and support systems, both from the employer perspective and the employee perspective. But can you tell me how you have seen, from the employer's perspective, opportunities and growth be transformed through the efforts to bring people with disabilities into our nation's private sector workforce?
Yeah, absolutely. Thank you, Julie. And I'm going to start just a little off track and tell you, I was a little bit nostalgic this morning hearing Secretary Laura Howard talk, because I started my career back in 1989, during some of the time that she was talking about working for SRS. And our priority, in the 80s and even mid 90s, I worked for SRS that she spoke about in the mid 90s on institutional closure. And we had a big, large institution in Kansas closing. And I am so happy, guys, that we're here today talking about getting people competitively employed in integrated settings in the community, because back then I was working with Cassidi on a book about why people should even be able to live in the community and their right to live in the community. And I'm so thankful. And oh my gosh, I didn't know I was going to get emotional about it, but I'm so thankful that we're beyond that. And I know we have work to do in that area too, but that we're beyond that. And we're now talking about how we can increase integrated opportunities and how we can increase opportunities for employment. So in the private sector, what I've actually seen are some things that, like Sarah talked about this morning, as organizations that support people with disabilities, as organizations that pay out the funds for disability services, we have the opportunity to really be role models in this area of what we're purchasing. I don't know if you guys are aware, but the state of Kansas in our contract with our Medicaid managed care companies has a goal of the percentage of people that we employ with a self-disclosed disability. And how are we recruiting, hiring, supporting individuals with disabilities working for our organizations? How are we supporting in our care coordination model, offering employment first and offering competitive employment as a first option to individuals, and helping them go beyond kind of figuring out what the barriers are. And I'm an overprotective mom, I'll admit that, but sometimes the barriers are talking to families about the vision for their child, and yes, this is a reality. Sometimes the barriers are talking to other businesses and showing and demonstrating to them the value of hiring and employing persons with disabilities, and talking with them about how they can support that. As you heard this morning, that there are companies paying for job coaching. So Medicaid's not the only payer of that, but companies can actually do that and retain their employees longer and help them to succeed. So I think, we've just seen vast growth in this area, and we still have a ways to go. But, I really believe that we need to be the role models of what we're hoping to achieve with others. So thank you.
Yeah, awesome. And, when I was now I go over and visit states to help them out on employment and human service program design. But when I was traveling around the country in my last role as commissioner, I got to meet many of the incredible leaders who remember the days of being in institutions, who remember the days of fighting to help get people, just like me and many of you in the room, out of institutions and into our communities. And just one generation later, we have incredible people all across the country who are going to work, who are getting great leadership positions who are growing their careers. And it's amazing what we can do in one generation. Right? One generation. If I had just been born one generation earlier, is what I always think about. So I actually want to turn to you next, Amanda, and talk about that, because I love to talk about the future. I think celebrating our victories one after the other is awesome, but I think we have to build from there, right? And what's next? And one of the things that I really would love for you to share with us today is when you see the employers that you get to work with, Kansas City Chiefs, Chick-fil-A, the health system, what are they looking to in the future? What innovations are they bringing to truly say, we as an employer aren't just checking a box, but we are welcoming people with disabilities into the fold of our fabric?
Yeah, that's a really good question. So I think at least in Kansas City, we're seeing quite a bit of momentum. We're seeing a big movement for inclusive employment. And I'm going to call some people out that are here. So I think part of it is very collaborative, where we're all working together. We wouldn't be where we are without employers. Employers are the people that are hiring individuals with diverse abilities. And it's because of them. It's because of the relationships that we have with them. And a lot of times it just takes getting your foot in the door. So we like to set everybody up for success, where I've worked in HR. I know how difficult it is to create a job description and a comp and class, a compensation and classification. And so we really try to make it easy for employers, where we start with maybe some paid internships, try a job for a few weeks and see if you like it. And it's a very low risk to an employer. And then if it's good, they'll stay long term. And if it's not, it's great for the resume. And so we like to set individuals up for success and set employers up for success. And I think it takes all of us working together. So we have some employers in the room. We have Northwestern Mutual. We have Brooke and Molly, who have hired Michelle. So Michelle has been working for them. She started as a paid intern, and now they've seen how much benefit she has to the company and how much she can contribute and what her skills are. And they've increased her hours. And we just were talking about trainings for the staff on how we can help the staff learn how to work with individuals with diverse abilities. Because a lot of times it's just equipping them with a toolkit. What an employment specialist does is not rocket science. We just help with task lists and timers. And the more that we can train everyone else on how to do that, the better, because then they don't need us anymore. And I think what we're seeing now is just really great employers like Chick-fil-A. Chick-fil-A is here today. They have a Flourish program that's an 8-week paid internship for people with diverse abilities. And corporate got a hold of the story, and now we're working on a video for other Chick-fil-A's to see if that could be an option. And it takes providers. I have my team here today. So Paige and Brandy are our employment specialists. When you hire good people, they'll do good things. And so I can train any skill. When I interview someone, I'm looking for their character. I'm looking at who they are. And we can always train a skill, but having good people. And then we have Jack Fuller, who's here. He works for I'm just calling these people out because you should meet them today when you're networking. So Jack Fuller works for the Kansas City Chiefs, the Kansas City Current. He's also on a billboard for Children's Mercy. If you're driving around Kansas City, his beautiful smile. Lola, who you met earlier, who works for I don't know how you have time for anything. She works for everybody and is in her career now. Greta, who is here. Greta, raise your hand. She works for us, and she also works for the KU Alzheimer's and Disease Research. So she is helping families, and she also works in the KU Cellular and Biology Lab. So we have people that are also Mandy and Ainsley back there. Mandy's her mom. Ainsley works for the Chiefs, and she worked at Levy Restaurants in the zoo. And she also worked at Chick-fil-A. So it's just incredible. You just have to build good relationships with employers and build that trust. And you don't have to have big, expensive things. Everything that we started was very small. It was 1 or 2 people, and it was job coaching, and it was training employers, and then it evolved over time. So I just think you just have to start doing the work. Like, just do it and just get your foot in the door, no matter what it looks like. We've all been there. We all get our foot in the door. We've all done internships. We've all had a lot of experiences. And when you're working with people with diverse abilities, it's no different. Sorry that didn't really answer your question, but employers are incredible. And I think as soon as you can get people to see things differently, like see a different perspective, and they start to see the benefit, because we're helping everyone work at the highest scope of their role, right? We're helping companies run more efficiently so that they're not burning out, and employees aren't leaving. And so I think once employers see a little bit of success, they call us back and they're like, can we hire 10 more people? It's like, sure. Why not? So yeah, it's just getting your foot in the door, and then employers automatically see it, and then they want more people who are going to show up to work on time and do their job and be great at it. So we're just finding everyone a space.
Well, and we have some statistics out there. I don't have them memorized anymore. I did for a long time, about people with disabilities often having better attendance and better engagement at work than our peers without disabilities. I like to say that's obvious to me, because I think I've had such wonderful experiences as both a worker with a disability and being a manager to one. I want to pull on a thread, though, because I think you made an awesome point. We all started our career somewhere. I started in an internship in a job program as well, and I've sort of navigated a fun adventure of a career myself. But Solomon, one of the things that I also travel around the country working on with several states right now is the issue that it's not just about the job, that it's about so much more than that. And that includes, I almost dropped them. That includes building a pipeline of talent for a company and building career advancement that you can see and work towards. I'd love for you to tell us a little bit about how you're envisioning that and advancing that, particularly from the inside. What does it look like to build real paths to career advancement for an employer who is seeing these successes that Amanda just talked about with employees who happen to have disabilities too?
Sure. You're really good at this, by the way. Because I'm like, I don't know what question you're about to ask. Any Hamilton fans in the room? So when you asked that question, what immediately popped in my mind is Hercules Mulligan. Sometimes you got to have that spy on the inside. And that spy on the inside is someone who can help with really focusing and driving efforts. So for us, CareSource, really, I would say a big push for us over the last couple of years was trying to prepare for the Kansas bid. Kansas, in a lot of ways, is really innovative in the asking or requiring that plans had to have a percentage of people with disabilities employed. And so for us, what we looked at was not necessarily checking off the box that we hire people with disabilities, but how can we have it embedded within the fabric of our DNA? And so that you're looking at the recruiting, advancement, and hiring of people with disabilities. And so part of that for us has been a journey. So we partnered with the Hocker Institute to help us really do a deep dive into where we are right now as an organization, where we were then 2 years ago. And it was tough. Because you think you're doing so much more, but you realize, no, you're not. And we looked at what benchmarks are. Part of what the Heartland Institute did was do an interview with a lot of different employees in our organization to get that feedback, to see, do you feel supported if you have a disability? Where do you see people with disabilities in our organization? And also, we had to do a gut check as to what is our disclosure rates, what is our disclosure abilities. And we saw that we didn't have that support there. So we've had intention over the last 2 years with creating different work streams focused on different areas. So accommodations to benefits to supplier diversity, as we're talking about competitive integrated employment, which excited for the panel later today, that's entrepreneurship. But for us with the recruiting piece, it's being intentional about finding those partners that can help with sourcing that pipeline. So if it is a Down syndrome's innovation, for example, that's one partner. If it's working with IPSI programs, if it's working, IPSI. I don't know the acronym for IPSI, so I apologize. Somebody in this room might. But but we're working really with establishing those partnerships with local universities, with different entities, with the Voc Rehab. CS Safe ER is another partnership that we're working with, but really being intentional about how we are hiring and where we're hiring, and looking at how we're also supporting people with disabilities in our organization when they do come into the door, that we are really helping them to advance. So I'll give one quick example, and this is something that pointed out to us. So I'm not sure about organizations that you work with, but some organizations have a firm limit that before you can look for another position, you have to be employed at that organization for 6 months. Well, that's great in theory, but what if you have the person who's hired in the wrong position? And now you may be forcing them to stay in that position, or you're putting them on a performance improvement plan because you're unwilling to be flexible with your policy. So that is something that we are also looking at as well.
That's awesome. I remind many of my managers of having the right person in the right seat doing the right work. It is really, really possible, and I have made this mistake myself, to have an incredible employee that we've got to just do a strength-based approach to making sure that they're in the right role. I think that might be true for me too. It's probably true for all of us, for sure. And, Cassidi, one of the things that I know that you're working on is making sure that it is a meaningful trajectory, and that when an employer says, we're going to set these goals, what should those goals be? That it's not just a check the box, but one of the things that you're working on in Kansas City is bringing lessons from the private sector to the city government, and working on making sure that people with disabilities are represented at all levels, and that we're not just capped at the entry level forever. Can you talk a little bit about how you're sort of building that model and expectation with employers that people with disabilities can be right there out of school at those entry-level internships, first out of school jobs, right, all the way up to the top of the house?
Yeah, absolutely. So I think in the easiest way that I would answer that question is the policy should be zero exclusion. If we start from that as the baseline, as the expectation, as the groundwork, and as a framework, not just with businesses, but with families. If we know, when we're talking to transition-aged youth, that without question, the expectation is that they will be competitively employed. That has a ripple effect to organizations that we work with when we're looking at hiring people with disabilities, because it is important to have internal goals and internal motivations, but to kind of piggyback on what Solomon said about making it part of your DNA, is if the organization has a zero exclusion policy and they are willing to be adaptive in what they can do to be inclusive, not just at those entry-level positions, because we all need a first job, but we all need a career, and very few of us are doing today what we were doing when we first started in the workforce. But historically, people with disabilities get stuck in those positions. Yes, they're able to gain employment and paid competitively, but they stay there for 30 years. And we don't, we want to see that advancement. So in the work that we've done with the city of Kansas City as a model employer, those conversations about, we kind of worked backwards, so to speak, and we challenged them to think about people with disabilities working at the highest level of our city government. It challenged perspectives. It challenged them as just kind of thinking about what they could do to be an inclusive employer. But because they were willing to lean into and have those challenging conversations, and that's not always easy to do. As a community organization working at that grassroots level, when you're going in and building new relationships with an organization, you kind of don't want to rock the boat. You want to have this, clear-cut blueprint of what they can do to start hiring people and be more inclusive. But they have to be willing to have difficult conversations, because otherwise what's going to happen is people with disabilities are going to be put in certain positions, in certain jobs, and there is going to be no advancement. And there's going to be this false assumption that they're doing the work when they could actually be doing a lot more if they're willing to go a little bit deeper and have more, maybe have some difficult conversations, but evaluate themselves.
So true. I want to I want to hang on to this theme that you can see quickly emerging on the panel around transformation and innovation. And something that I really loved, I did get to talk to the panel before today. As I was reflecting on some of my notes from a conversation last week, Stephanie and Amanda sort of took that conversation and then turned it around. And I would like for them to share, both of them, to share with us, not only do we need to push employers to change the way they think about hiring, recruiting, hiring, and retaining and promoting employees with disabilities, but we as the people who are working alongside them to fill in those knowledge gaps, to give them the supports and information and confidence to do it, we need to understand that their needs are always changing too. I can tell you as someone who's been managing for the better part of the last 20 years, my needs as a manager have changed as my employees' needs have changed. But Stephanie and Amanda, can you comment and tell us a little bit about how you keep your finger on the pulse of what employers need and bringing employment of people with disabilities to those gaps that they have in moving their businesses forward?
I think the first thing is always to listen. We don't come in and say, you should hire someone with a disability. We don't do that. We listen to what their needs are. And our first step is to always do an organizational needs assessment where it's like, what are you getting dinged on? What are you, in your surveys, maybe customer service is lacking. That was with Levy restaurants. They had surveys come back and say, hey, no one's greeting us at the zoo at Tuxedo Grill. And that created a position that now is year long, and we have people that are always in those positions. And KU Med, I know I'm looking at Joanda Mast because Rachel works, I know your daughter works at KU Med, and they have people that are working in the dining facilities and working as greeters. And now we have people in clinics. So we actually worked with them and they said, man, we are not... they had people at the check-in and check-out desk, and people were getting pulled away from the desk. So people were coming out, and no one was there. No one was there to check them in or out. And they made a list for us of all the tasks that were pulling them away from their desk. And now we have someone that's a patient services representative assistant. It started as a carved position. Now it's a customized position. And they work 22 hours a week. On the 4th floor in internal medicine, doing all the behind the scenes tasks that are administrative. That way the PSRs can actually do their job. And so the first thing is to listen to the needs of employers. They're there. You have nurses cleaning exam rooms. You're losing thousands of dollars. You could hire someone to clean exam rooms, and then that nurse could see 5 more people every day. So it's just finding ways to help companies run more efficiently. And I think a big piece is employers talking to employers. That's the big, because they understand, they get it. The Chiefs, this is our 4th season. The Royals saw what we were doing and they were like, we want to be a part of that. And now it's our 2nd season with the Royals. Then the Kansas City Current saw what we were doing because the staff used to work at the Chiefs and they're like, we want to be a part of that. We need to do that. And it looks a lot different. Let me tell you, 80 baseball games is a lot different than 10 football games. I will tell you, but we had a blueprint and we had a system and we said, here, we know what is going to work and let's tweak it to fit your needs and then scale it. And then, so we started with just a few people and then it grew and then it grew and then it grew and we've faded out job coaching support. So it's incredible for employers it's a very collaborative effort. And we need caregivers talking to caregivers. We need employers talking to employers, providers talking to providers, because I have a very limited perspective. I'm not a caregiver. I'm not an employer. We do hire individuals with diverse abilities, and I'm their supervisor, so I'm actually an employer. But I guarantee you people are going to listen to the Chiefs more than they're going to listen to me. So, so I think scalable, sustainable systems and mobilizing providers with employers and listening to the needs and being able to evolve over time. because a lot of those positions that you're talking about disappear. You see self-checkouts now instead of people bagging groceries, and you see drive-throughs instead of lobbies at restaurants. And so our individuals always have to be cross-training and skill building so that they don't get fired. They don't get let go. They cannot be the first people to be let go. They have to continue to build their skills. They have to continue, just like all of us. And I love what you were saying, like none of us are in our first jobs. My first job was in a restaurant. I'm not in a restaurant anymore. And so if people want to stay in that job, that's totally okay. But career advancement should always be an opportunity, and especially learning more skills if they want to stay in that environment.
Yeah, I completely agree and echo. I think we need to listen and we need to continue to adapt. And, we've certainly learned as a company that we need to listen at all different levels. There are business collaboratives that we've been a part of that are very important where, businesses are talking about this very issue and how can we educate ourselves more? What are the ways that we can adapt our career ladders and our job descriptions and those types of things to recognize the importance of employing persons with disabilities, the value of it, but how we continue to do that successfully. We also really need to be listening to the individuals that we support and what are they hearing from their employers. And I want to call out Steph Sanford today because we actually just entered into a partnership with them to help us be better at listening and to engage people who have lived experience in a more meaningful way on our advisory councils to really hear. Are you gonna, oh, okay. I thought you were going to say something. I was going to say, there are a bunch of folks in the room that I would just love to recruit because we need to be listening to you guys about, listening to people like Colette say, why are you still being refused a job? What's going on that's causing this to happen? Or, why do you feel like you're stuck in your career and not able to move forward? And how can we better support businesses with listening and understanding, but support you also with how to move up in your career as well. And then we have the opportunity as a health plan. Cheryl Locker is here with me today. She's much more of an expert on this than I could ever dream of being, but she runs Project Search for the state of Kansas and has the opportunity to hear from both employers and individuals who are transitioning out of high school and stuff to employment, what the barriers, what the challenges are, and to kind of keep our pulse on what's going on and how can we help change, educate, and adapt. So, listening and supporting meaningful change.
Awesome. So I want to hang on to this, and before I give the question, Solomon and Cassidi, I am going to remind you that you are 9 minutes from everybody eating lunch. So you not only get to answer this question, but you get to help take us to lunch, which we're all excited about to continue that conversation informally, but kind of building on some things that Stephanie and Amanda just talked about bringing the needs of the business to demonstrating that people with disabilities can really be a part of that solution. We often do, and I've seen this play out throughout my own career. I've sort of been on this wild ride up and down the East Coast. We see this where when we talk about people with disabilities, we talk about what accommodations do we need. We talk about what supports do we need. What does that look like to successfully integrate fully into the business? But we don't often start the conversation instead about why do you need people with disabilities working at your business? Your business has a deficit you don't even know about. I'm actually working with a state who says we've got to get more people into our job market. And I'm like, let me tell you about people with disabilities. But how do we reframe the conversation, Solomon and Cassidi, around with employers to understand that they are experiencing a deficit when people with disabilities are not in that fabric that you were talking about earlier, Solomon?
I'm going to give it to Cassidi. I'm really interested in her response first.
All right.
It's what you should be doing. If you're not doing it, you're missing an opportunity. If you're not doing it, you are limiting the, just so many different things within your organization. And so when talking to, businesses, that would be, that is the conversation. It is, not do you want to hire with people with disabilities, but what are you doing to hire people with disabilities? It's not a question, it's an expectation. So.
Cassidi undersells herself a lot. So that's why I was like, I really want to get Cassidy's perspective on this. So we have an external disability inclusion advisory board that's helping us along the way to give us that feedback. So similar to how Stephanie phrased with the work that's doing with SAC and the upcoming collaboration. Likewise for us, in order to really move that next needle, we recognize that we have to have that voice of the person with lived experience, because otherwise what we miss out on is the focus is on accommodation. And so during our most recent advisory board meeting, we somebody who was external, who was on this board, said, I'd rather see it as investing in people with disabilities, because really if you invest in me, it's because you believe in me. And so I think that what I would task here for the rest of this group, obviously this is the choir. We all are speaking to the choir today, because you're here because you believe in the message, or somebody said you need to be here today. But for you, what is that takeaway that you are going to do to help drive the conversation on either side of the needle, either from a policy perspective, from the employer perspective, from the person who's the self-advocate, person with lived experience, or even on the health plan side? There's actions that all of us can do, and it does start with that question you just asked around, what are we doing with, how are we making this a priority? And because it is the right thing to do. It drives innovation. It drives change. So especially on this side of healthcare, I want to have somebody with that lived experience be in the driver's seat to help with accommodations. Can you imagine someone with lived experience on the side when it comes to authorizations and utilization management, which is the evil word? It's a different conversation when you have a care manager with that experience. And so that's my vision. My vision is that we have the CEO of CareSource in the future that will be that person of lived experience, the chief medical officer, because it is the right thing to do.
If I could add one last thing before you all go eat your lunch. I want to kind of take what Solomon said and add a little bit to it, to what Stephanie shared earlier. The conversations that we were having about no more people living in institutions, the conversation we should be having about no more businesses not employing people with disabilities.
Yes. I also am just going to tag on here because you said we have a couple minutes and I'm a talker. So one thing I think is really powerful is employers seeing the benefits of hiring inclusively, and for all the changes that happen. And not just to open the door for individuals with intellectual and developmental disabilities, but to open the door for individuals that have other barriers to employment. Like maybe it's ESL, English as a second language, or it's veterans, or it's adults aging out of foster care, or it's people who have been previously incarcerated. It's people, what we do is like we have them try the job. Who would have thought maybe trying a job before you spend thousands of dollars hiring somebody and then they leave 6 months later. So they're like, wait, can we do this for everybody? Can we have everybody try a job? And even if that's not the case, we know that more goes into the job than just the job itself. Like they get a tour, they get to meet the staff. It's like when you're going to a college campus, you're like, oh, I feel like I fit in here, or maybe I don't, and that's okay. And like just seeing the environment and what it's like. And a lot of times what we do as employment specialists, I'm looking to my team, is we create visuals and little task lists. And then they're like, wait, can we hang this up for everybody else? Sure, absolutely. You can add this visual for everybody else because a lot of us are visual learners. And we try to make it as easy as possible. We're not like saying, oh, let's have this meeting and we're going to do this. Like, no, we'll just join your orientation that you're already having. That's easy. Like you're already going to have this orientation anyway. Let's do a 30-minute training on how to work with individuals with diverse abilities. Easy. And then it's not a one and done. You have to continue that training, and you have to do a more in-depth for those individuals that are working at that place. But it's just great. Like, it's like if I got a job and it's like, here's how Amanda learns best. Like, here's my triggers and here's what I need to succeed. And it's like, that's great. That would be super helpful to an employer, knowing that I'm not going to read a book. I'm not going to sit and read, but I'll listen to an audiobook or I'll watch you how to do it. And so it's just getting employers to open the door to everybody, all these untapped pools of talent. So I'm giving this. You have one.
You can grab it.
You get your
you can
own.
hold it on. I think that's a really important point, and something we aren't going to get a chance to talk to about formally. One of the things that we talked about as we were thinking about joining you all this morning was the idea that when we hire people with disabilities into our workforces, especially in the private sector, we aren't just diversifying the workforce of today. We aren't just helping people build their financial wealth, build their path to financial success. We aren't just helping people lead healthier, happier lives, which we have data to suggest. The panel also agreed that one of the things that employers do for our communities is they allow parents and future parents to see adults working in the workplace that look just like their kids. And so when you are diversifying your workforce, you're also saying to your community and all your other employers, everybody can be a part of productivity and work. And at the most human basic level, that's recognizing every person in your community. And so I'm really excited that we got to do this panel. I'm excited to be here in Kansas. I know from my own personal experience that working in the private sector as a person with a disability can be rewarding and meaningful and exciting and integrative. It takes a little bit of self-advocacy sometimes. It takes a little bit of working with your employer sometimes, but it can be done. And you've got great leaders here in Kansas.